Ask the expert and Dr. Larry Mann, Doctor of Osteopathic Medicine, a board certified family physician at Bronson Family Medicine. That's the new one over there on Helmer Road. And we are going to talk about the importance of primary care. Good morning, Dr. Mann. Nice to have you with us today.
Morning, Tim. Thanks for having me on.
I go back past that new building all the time. It's very handy, very great location there on Helmer Road, right off I-94.
I love it over here. It's a fantastic location. We have great staff, and it's a great place to come for your primary care.
Yeah. Now, when we say primary care, Dr. Mann, I think we all know, but spell it out for us. What exactly are we talking about?
So what primary care involves is it's either a doctor, a nurse practitioner, a family assistant who helps regularly keep an eye on your health, can do checkups and routine physicals. The benefit of them is they are able to see you on a regular basis and get to know you in a detailed and unique way. Everyone should have one, even if you don't have a severe illness or something you get treated for. And if you don't already have one, you can call us at 269-341-7788. In Battle Creek here, we have a family medicine and internal medicine practices. The biggest difference between the two of those is basically the age groups that we treat. For me in family medicine, I treat patients from just after birth through all stages of their life, while internal medicine focuses mainly on patients that are older than 18. So the benefit of seeing a family provider is you can see the whole family. And I see several groups of families now that, I see the children, I see the parents, I see the grandchildren. It makes it a lot easier for them to all come to the same location to get care.
Well, not to mention the fact that, you get to know a patient and you get to know their history, but also how, family history can kind of fit in with all of that.
Yeah, it's extremely important. It allows us to really get to know the patient. And when I'm dealing with the whole family, I really, I have a much better understanding of what's going on in that patient's life. We help to treat all areas of your health care, including chronic conditions like asthma, COPD, diabetes, hypertension, as well as things like anxiety and depression, something we commonly see as well.
Hey, flu season, I'd be remiss if I didn't bring it up. What should we be doing right now?
So the biggest thing that everybody can do to help prevent flu is get vaccinated. There's lots of talk about these immunizations causing things like autism and stuff like that. Some very detailed, prolonged studies over the course of numerous years have been done, and they've shown no link between any kind of vaccination and autism. You can get these vaccines either at your primary care office or for us at a Bronson outpatient pharmacy. You should do things like keep your immune system healthy by eating balanced diet, drinking plenty of water, and getting enough sleep every night. So what do you do if you do get a flu? The big thing with that is certain steps to take. Healthy people without chronic conditions, a lot of times this will go away on its own. You just kind of continue to get enough rest, get enough fluid, avoid contact with other people. The CDC recommends staying home for at least 24 hours after your fever has gone away, except for the case where you need to get medical care or go to the emergency room. For those folks that have, serious chronic conditions or their immune system is compromised, you should really get a hold of your primary care office. Because, there are some medicines out there that we can treat you with, and we can start to help alleviate these. The antiviral medications, I don't know if you've heard of Tamiflu or not.
Sure, yeah.
It's prescription only. Usually if you can get it within the first 48 hours of becoming sick, it usually lessens symptoms, shortens the time you are sick by about a day or two, and some of the side effects of the medicine, however, are a little bit of nausea and vomiting. You should contact your primary care office, if possible, if you need treatment.
Now, speaking of primary care providers, what if somebody doesn't have one? What should they be doing? What can they do?
So, you can look in the local areas. For us, We have several practices that are accepting new patients right now. Our practice is Bronson Family Medicine on Helmer Road, Bronson Family Medicine in Marshall, Bronson Internal Medicine at Fremont Street, which is down by the hospital, as well as Bronson Internal Medicine and Rheumatology. You can get a hold and schedule an appointment with any of these offices by calling 269-341-7788. Though they can kind of gear you towards whether you want family medicine or internal medicine or which location is most convenient for you.
And one nice thing is they're all hooked together with technology now. So if you go and have your lab work done at a Bronson lab, it's just everybody sees it. It's in front of everybody, and there's including yourself. You can go online and view the results of your lab almost immediately. And so I kind of like that. I mean, it's a pretty powerful network, isn't it?
It works. I really like it. We use what's called the Epic system for our medical records, and yeah, it does. It links everybody from us at the primary care, our labs, our imaging, as well as if something happens and we need to send you to a specialist, we can see a majority of their notes now, so we can get a good understanding of what their plan is going forward, and it helps us kind of coordinate what the patient's care is.
Dr. Larry Mann, Doctor of Osteopathic Medicine, Helmer Rd, Bronson Family Medicine. Thanks for joining us today, and happy Thanksgiving.
Thanks, Tim. You have a happy Thanksgiving, too.